Hi class, my name is Jory Freeling and today I will be speaking on colorblind approaches to public health and how they are fundamentally flawed because they mask the significant health disparities affecting racial and ethnic minorities. By ignoring the role of race in health outcomes, these approaches fail to address the unique challenges faced by communities of color, which experience disproportionate health burdens due to historical discrimination, environmental injustice, and structural inequalities. Public health strategies must explicitly recognize racial disparities to effectively promote health equality and fulfill the ethical obligation to ensure that resources and conditions necessary for health are accessible to all community members. Ignoring racial and ethnic disparities overlooks how inequities intersect uniquely for communities of color. The Unnatural Causes Interactivity, A Perfect Neighborhood, states across the country, toxic and polluting industries are disproportionately concentrated in neighborhoods where people of color live, with data showing that 40 out of 44 states with hazardous waste facilities, minorities are overrepresented or overrepresented in host neighborhoods within 3 kilometers. Again, to reiterate this, people of color are also consistently experience worse health outcomes than white at the same income level, including increased rates of infant mortality, and also experiencing the daily experience of racism, which elevates chronic stress levels and worsens overall health among these populations. Colorblind approaches often obscure the disparities caused by environmental and social factors in disadvantaged neighborhoods. In Unnatural Causes, A Place Matters, the narrative of Richmond, California exemplifies this problem with disproportionately high rates of asthma, exposure to petrochemical pollution, increased rates of diabetes, and lower life expectancy, all having a correlation with the systemic neglect of the neighborhood. As sociologist David Williams notes, health is embedded in the quality of neighborhoods and housing, highlighting how racial and spatial inequalities directly impact health. To further this, epidemiologist Anna Diaz-Rue, her research demonstrates that residents in such neighborhoods face a 50 to 80% increased risk of developing heart disease, again underscoring the critical connection between place and health outcomes. Segregation and historical structural discrimination have also placed minority groups in areas that continue to exacerbate these inequalities, making it more difficult to break the cycles of low socioeconomic status, which in turn also affects your health outcomes. In Richmond, California, African Americans and other minorities were historically excluded from government-backed loans that helped white families relocate to healthier suburban areas after World War II. This deliberate policy of exclusion confined minorities to this disinvestment cycle, being increasingly neglected in this urban area, managing really poor infrastructure, unsafe public spaces, low quality housing, what some have called the poverty tax. They're managing disproportionately expensive goods and services that further limit residents' choices and increase their financial stress. The claim that personal choices determine health outcomes oversimplifies the lacks of consideration of how structural factors constrain these choices. As stated in Unnatural Causes, choices of individuals are limited by the environment in which they live. Residents in disadvantaged communities face barriers including limited access to nutritious food, safe physical active spaces, quality healthcare, and economic opportunities. These conditions are not accidents or choices, but results of systematic disinvestment in communities of color, demonstrating why race-conscious approaches are necessary to accurately identify and address these barriers. The Public Health Code of Ethics explicitly states that the field should advocate for or work for the empowerment of disenfranchised community members, ensuring that the basic resources and conditions necessary for health are accessible to all people in the community. Fulfilling this obligation requires acknowledging how racism, whether overt discrimination or structural disadvantage, influences resource distribution, environmental exposures, and opportunities for communities to reach their full potential. Race-conscious policies are therefore not only practical, but ethically necessary.